Dr. Anand, so good to see you again. I asked you to cover a topic briefly that everyone is more and more interested in, and that's wellness, healthy aging, and increasing not just our lifespan, but our health span. That is, to live long and be healthy for the whole time. For me personally, I was jogging this morning, 6 miles, and at the gym yesterday, and there are lots of folks in later life who are very focused on avoiding frailty, staying healthy, and to be honest, looking good as we age. You are very optimistic and promise to give us all hope in these areas. So please tell us briefly what you and your team at Neurxstem are uncovering and ready to offer in aging and longevity.
This is actually a very interesting topic because this year I turned 65. So for me, this is just as important as it is for the vast majority of the world population that is aging today. And the cost of age-related disabilities is rising. It is an important aspect both economically, at the personal level, and what I'm going to do is firstly define what aging means to me, as opposed to age-related disorders and diseases, and then we can take it from there. So my company, as I've said this many times, is a predictive and precision genomic company. And our goals in aging are to say, can you predict how somebody's aging and the rate at which they're aging? And of course, it is critical that we then be able to address these things at a much earlier stage so that, as Kevin just mentioned, we can have a healthy lifespan. That is, we do not have disabilities for most of our life and live it fruitfully doing the things we enjoy doing as we get older. So, to study aging, we began to ask the more important question, what is aging really? And aging is the progressive loss of physiological integrity, impaired function, and of course, increased vulnerability to death. But we know in the world population that there are some people who have accelerated aging. The rate of aging is accelerated in a disease called progeria. They typically don't live past 14 or 15, unfortunately. They show all the signs of aging, both externally and internally. And there are others that live in the blue zones all over the world, and they have a much slower rate of aging. And so to understand aging, as opposed to what I'm showing at the bottom, which is age-related deterioration, risk factors like cancer, diabetes, and cardiovascular disorders or brain disorders, we began to say, can we compare the brain models that are made from somebody who suffers from progeria, the donor is progeria donor, and somebody who's lived a full life without any real impairments that match that of a blue zone. They are up in the 90s and 100s. And so what I'm going to describe to you is the exciting work that we have done. And on the left-hand side is a very famous young gentleman who passed away named Adam, who was a big advocate for progeria. And on the right-hand side is somebody who lives in the blue zone. And these are some of the 5 areas in the world. They include Greece, Sardinia and Italy, Okinawa and Japan, Costa Rica, even in the United States, where they live quite healthily. And so to get a deeper understanding of what is driving aging per se, we made a brain model of progeria, which would seem a little unusual for a disease like progeria. But our approach was pretty much the same as it is in what I've described before. And that is, we look at the differences in expression of genes between those who have progeria in the brain model and those who have had a healthy lifespan. And we collect data where we are looking at transcriptomics, so that is the differences in expression of the genes, and also metabolites, and that is how are the metabolites changing as a consequence of having progeria. And we were quite surprised to discover that in fact we were able to replicate all the hallmarks of aging. They are DNA stability, telomere attrition, epigenetic alterations, proteases, and a number of them, there are almost 15 of them, including immunity, chronic inflammation. And here on the right-hand side are the biomarkers for each one of the hallmarks of aging that are dysregulated in those who have progeria, even in the brain. It's just that they pass away from other comorbidities before they begin to see the deterioration of the brain, which is why it's not typically reported in those who have progeria because they pass away by the age 14, 15. And so our approach is now reaching a point where we can now use this very same strategy to personalize aging health span medicine, where we can develop the kind of tools we need. From the big omics data, we can get an early diagnostic profile that is personalized to you. We can ask questions like, how does nutrition actually alter it? How susceptible are you to environmental factors? And then, of course, based on this combination of genes, nutrition, and the environment, we can come up with very unique, highly personalized strategies to actually intercede long before you get to the age of myself at 65, and maybe at a point where we are not as malleable as we would be when we were 16 or 20. But I still believe that we can do a lot better throughout our lifespan. So that's our strategy. This is a summary of what we've done. And we now actually have a drug that is altering many of these biomarkers. Very, very exciting. For the first time, we're beginning to understand what is truly driving aging. And it turns out, again, it's inflammation. And we don't see any other dysfunction that is correlated with aging. And if we are able to mitigate this using the kind of drugs we have developed, we're very hopeful that this would be a one of many strategies that come out of the stem cell precision medicine era to alter and make our lives better as we get older. And so this is just where we are in the trajectory towards the clinical markets. We have preclinical molecules, as I said, that are even good for aging therapeutics. And that's our trajectory. This is how we do things across all the diseases. And with that, I want to stop here. Thank you all for your attention. Thank you, Kevin, for hosting this podcast, and hope to see you next time.
Thank you, Dr. Anand. That's very exciting. We look forward to hearing more about it in the future. And then we've got some other video casts coming up as well.
Thank you both for the beautiful efforts. And I'm talking both, meaning that some of this work that I haven't mentioned before was also part of the co-inventor was actually Susan McKay, who in the beginning actually was involved in actually making the human brain. And today, because of that work, we are now exploring new frontiers in so many different areas. And that's the exciting thing of a platform technology. It can allow you to do all sorts of things that you couldn't even imagine had we not made it. Thank you all. Bye-bye for now.
Bye-bye.